I heard you've been somewhere special recently.
There was a very important forum recently held in Korea. You know the SMILE surgery that's commonly performed for vision correction? There was a forum where only ophthalmologists who perform that surgery gathered to discuss and share opinions, so I attended it. This SMILE surgery has now surpassed 10 million cases worldwide. In Korea alone, about 1.6 million of these surgeries have been performed. That's how many people have undergone SMILE surgery so far.
I heard you were the very first one to give a presentation at the forum.
There's something called a keynote speech that summarizes the significance of the forum. Since I was one of the pioneers of SMILE surgery, I was the one who gave that keynote speech, delivering a concise summary presentation.
What exactly did you talk about in your presentation?
In a way, I explained everything from the historical background of SMILE surgery leading up to SMILE Pro, to what advantages SMILE has that made the trend shift from LASIK and LASEK back to SMILE. It is noteworthy for its minimally invasive design, stable biomechanical structure, and fast recovery. And I also explained what issues are currently being raised in the surgical process of SMILE, which ones have already been overcome, and what challenges we still need to address in the future. Then I suggested how SMILE surgery should further develop in the future and how I hope it evolves, summarizing everything by dividing it into past, present, and future perspectives. While there are many variables, I believe SMILE surgery will continue to stand at the center of refractive surgery and drive future progress. One of the important points is this. In eyes with limited corneal thickness, SMILE surgery is more stable than LASIK surgery. And also the damage to the tissue is much less. Especially with SMILE Pro, as many of you know, it's extremely quick and precise. And because the quality of the laser beam is excellent, the surgical stability and outcomes are much better as well. Probably further development will continue even beyond SMILE Pro. When explaining the direction we should take in the future, I mentioned that since technology has advanced to the point where we can quickly grasp, analyze, and create various forms, I made one suggestion that perhaps we should move toward AI-assisted customized SMILE surgeries. And secondly, as we get older, presbyopia occurs. I believe it's natural for us to advance towards SMILE surgery that can also partially overcome presbyopia, because the current SMILE Pro equipment already has the hardware and software capable of making that possible to some extent. I proposed the idea that if we further develop this aspect, SMILE could also become a solution for presbyopia. There are now many types of surgeries in ophthalmology, and vision correction surgeries are the same. Technological advancement of the equipment is extremely important. So we can expect that vision correction surgeries will continue to develop even further from now on.